in on today's episode as you and I dive into some of the natural ways that you can prevent UTI in the women. In fact, over 500,000 of women experience UTI in their life, and they keep taking antibiotics all the time to cure their UTI, but only to find out that the next month they develop another UTI. So they keep taking antibiotics all the time. And you and I know that antibiotics, when you keep taking them, you develop resistance to them. And after a while, most of the common antibiotics that will work for UTI no longer work. So what is one of the ways or some of the ways that has been proven scientifically that you can prevent UTI in the female? Today, let's dive into a non-antibiotics prophylaxis of how you can prevent recurrent UTI. Now, let's dive into it. The very first one that you are looking at is the vaginal estrogen. Vaginal estrogen is usually prescribed in people who are in their post-menopause who keep developing UTI because of the depletion of estrogen. And so what vaginal estrogen does is that it restores the vaginal flora and therefore reduces the pathogens that causes colonization of the bladder, therefore causing UTI or recurrent UTI in women, especially in the postmenopausal. So if you are postmenopausal, then using vaginal creams or any of the vaginal estrogens will reduce your amount of recurrent UTI significantly. This is a recommendation by the American College of Obstetrics and Gynecologists and also by the Urologist Association. Of the European Association of Urologists make this as a very, very strong recommendation for women in their postmenopausal and who has recurrent UTIs. Now, the next thing that is being in study or has had some moderate efficacy is the use of cranberry product. In fact, most of the women who are watching this video right now, you've been taking cranberry, and actually there is evidence to prove that. And the evidence is that inside of the cranberry there is a substance called proanthocyanidins or PAC for short. And what they do is that they will inhibit the bacterial adhesion to the bladder and therefore reducing the recurrent UTI. And the study that was done is a Cochrane study that was done in 2023, actually shows that if the cranberry contains at least 36 milligrams of the proanthocyanidins, then they have a strong efficacy of reducing recurrent UTI in the female. So if you want to take a cranberry product, make sure that you look at the label and the PAC or the proanthocyanidin has at least 36 milligrams. So that was the studies that was done, and it showed the efficacy of using cranberry products to prevent recurrent UTI. And this works for both postmenopausal and premenopausal or any woman who is experiencing recurrent UTI. And the evidence is very strong. Again, it's a Cochrane studies of that. The next one is called D-mannose. D-mannose, the evidence here is moderate to strong evidence. And what it does is that it inhibits one of the bacteria that causes UTI called E. coli. So it inhibits the E. coli from attaching itself to the bladder cell or the bladder wall, and therefore preventing the UTI recurrence. And this can be formed in a powder or a capsule form, and make sure that it's in 2 grams at least daily. And again, there was a study done in 2014 where they compared D-mannose to the antibiotics called nitrofurantoin in preventing UTIs, and the comparison was pretty much the same. So if you take D-mannose, you find D-mannose, you can order it online. That can help also, but at least it must have at least 2 grams daily will prevent recurrent UTI. Number 4, what about probiotics? Do probiotics work in preventing UTIs? Well, the evidence is very weak to moderate, okay, because the mechanism is that the probiotics will restore the normal vaginal flora, therefore suppressing the pathogens that cause UTI. But again, this is a very weak to moderate evidence. So if you have recurrent UTIs, they might not be your first choice to go to. But probiotics can also restore the vaginal flora. So if you take this in combination of, let's say, D- or cranberry, the purebred, you might get increased efficacy in reducing recurrent UTI. The other one is also, the fifth one is behavior or lifestyle modification. Lifestyle modifications, the evidence is very variable, okay? So it's not like a very strong evidence, it's very variable. However, they found out that if women did one of the following things, all right, they have the chances of reducing recurrent urinary tract infection. For example, post-coital voiding. So after sex, you go in and pee, void. The evidence is low, but again, it does not hurt to do that. And also adequate hydration. This supported by a randomized controlled trial that was done in 2018, that if you have adequate hydration, what it does with that is to reduce the colonization of bacteria in your bladder, therefore reducing recurrent UTI. And the evidence was to drink at least 1.5 liters of water per day, and that will reduce colonization in your bladder. So if you did a combination of all these things that we are mentioning, I think that your chances of having recurrent UTI will be very, very minimal, so that you can reduce the discomfort that recurrent UTIs produces. The sixth one, the evidence is also a non-antibiotic evidence in methenamine. Methenamine is spelled M-E-T-H-E-N-A-M-I-N-E. Methenamine, the evidence is moderate, and there was a trial done in 2022, and they saw that it was as effective as using low-dose antibiotics. And the mechanism is that this particular product is converted to formaldehyde in acidic urine, and therefore prevent the growth of bacteria. So these are some of the things that, if you are experiencing recurrent UTI, you should be thinking about doing. This will help you in a great deal to reduce the recurrence of UTI, so you don't keep taking antibiotics. To recap, when you adopt this natural method that I just mentioned, you can significantly reduce your risk of having recurrent UTIs and not having to be taking antibiotics month after month with all the side effects that come with antibiotics. So if you found that this video has been helpful to you, and my goal is actually to help you, because I see a lot of women coming with recurring UTIs. So if this video has been helpful, you can share this video with other women who are also suffering the same thing. And you can come back to this channel and leave me a comment of some of the product that I just mentioned has worked for you, and so that other people can also benefit from it. Like I always say, in the 21st century, you are your own doctor. So having good information is very important to keep yourself healthy. Until then, I'll see you on our next health tip.